come to order. Before we proceed, I ask unanimous consent that Dr. Miller-Meeks and Representative Hageman be permitted to participate in this hearing. Without objection, so ordered. I want to welcome our witnesses from the Department of Veterans Affairs and the Disabled American Veterans. Today we're going to discuss the Beneficiary Travel Service System, or BTS-3. This effort began in 2019 to automate veterans' travel, reimbursements, and eliminate improper payments using a new web-based system. I'm sure the idea made perfect sense and looked good on paper. But in reality, VA blindsided millions of veterans with a complicated and confusing new process. Training was minimal, and user testing was limited to a small group of VA employees. Without warning, the department deactivated and then removed the popular VetLink kiosk from most of its facilities. Veterans have been successfully using the kiosk for years, but veterans struggled with the new website, and they continue to struggle with it today. I'm proud to represent one of the most rural districts in this country. Montana veterans travel long distances to receive the health care they have earned. I routinely hear from my constituents about the frustrations with the new systems and the struggles to get reimbursed on time, if at all. As a result of these problems, most veterans are relying on the paper travel reimbursement form, and a huge claims backlog developed that took several years to work down. We've seen this movie time and time again, unfortunately. VA undertakes an ambitious IT modernization project to revamp a business process, but it fails because it isn't developed with the user in mind. And veterans who rely on the system to manage their health or finances are the ones that get hurt. In this particular situation, BTS-3 caused confusion and frustration for veterans across America who count on receiving travel reimbursements when their VA medical appointments are not available close to home, which, based on the $2 billion a year expense associated with this program, is quite often. Maybe another opportunity to expand local health care delivery, but that's an argument for another day. This project has been a glaring example of poor planning, misunderstanding of veterans' needs, and general dysfunction. According to the Office of Inspector General's report, the system is a long way from meeting any of its goals. The contract was signed 8 years ago, but as of last year, only 34% of travel reimbursement claims were being submitted electronically. 8 years. That is far below the goal of 80%. The project was supposed to simplify the entire travel reimbursement process by auto-adjudicating 90% of the claims. But as of last year, the system was only able to auto-adjudicate about 40%. Veterans submit about 6 million travel reimbursement claims every year. A majority of those claims have to be keyed into the BTS-3 system manually. Worse, the software is completely unable to auto-adjudicate travel reimbursements for community care, so 100% of those claims have to be manually reviewed. More than 4 years after the system was rolled out, the VA still does not have a good solution for that. VA actually had to add about 140 more employees to process the travel claims manually. The project's budget started at $11 million, which is modest compared to Oracle or the supply chain modernization. But I understand now that it's doubled. The budget does not seem to include all the additional expense from the extra staffing and rework. And it surely doesn't account for all the veterans' frustration and wasted time. I expect clear answers from our witnesses about the path forward. Despite several years of software updates, the BTS-3 system is still too difficult to log into, too slow to load, and too confusing to navigate. We learned that the VA is planning to fold it into va.gov soon. Given the difficulties that other parts of the va.gov have experienced recently, that consolidation needs to be handled very carefully. Now that the VA has shown that the kiosk can be integrated with BTS-3, we need to see an orderly plan to reintroduce the kiosk where the veterans want them. Most of all, we need to know that any further changes to this system and the travel reimbursement process will be tested by real veterans and clearly communicated before anything gets pushed out. We cannot allow another VA IT project, even a relatively small project, to escape scrutiny while it burns through taxpayers' dollars and undermines veterans' care. Once again, I want to thank our witnesses for joining us today. And with that, I will yield to Ranking Member Sheriff McCormick for your opening statement.
Thank you, Mr. Chairman, and I'd like to say thank you to our witnesses for being here today. Over the year, VA has taken on many programs that seek to make healthcare access at VA more equitable for all veterans. Today's topic, the Beneficiary Travel Service Systems, Self-Service System, BTS-3, is one of those efforts to help relieve veterans' expenses incurred while traveling to approved healthcare appointments. In FY 2021, VHA reimbursed over $1.3 billion in travel expenses to veterans. That's $1.3 billion worth of mileage compensation, tolls, parking, and in some cases, airfare and specialized transportation costs. Reimbursing these costs is important to building trust with veterans and not inflicting financial hardships while veterans utilize the health care they have rightfully earned. Historically, veterans have relied on a paper-based process that required VA personnel to manually enter the data into VA's legacy electronic healthcare records, VISTA. VA has been trying to replace that system for the past 5 years, but that's a conversation for another day. BTS-3 is an attempt to modernize VA's legacy beneficiary travel program by adding additional electronic functionalities like electronic submission, automated adjudication, and improper payment detection. These features aim to decrease administrative efforts, erroneous payments, and processing times. However, a May 2023 report from VA's Office of Inspector General found that the new system was not meeting any of its 4 established goals regarding auto adjudication, system usage, manual overrides, or self-service utilization. Since the release of the report, VHA has taken steps to address these failures. Recent data has shown improvements across these key metrics, like auto adjudication, payment timeliness, and improper payment rates. For example, in FY21, BTS-3 faced nearly 14% improper payment rates, and only 20% of the claims were auto-adjudicated. In FY23, over 40% of the claims were auto-adjudicated, and improper payments were actually down to under 7%. While these matrices still do not meet the set goals established by the Veterans Transportation Office, I'm glad to see that the VA's growth in this area. However, despite these promising improvements, I remain concerned on several fronts. In our pre-brief hearing last week, we learned that in January, 8 years after the contract was awarded, OIT began discussing the need for a governance structure within the BTS-3 program. I'm fairly concerned that if a solid governance structure had been in place from the very beginning, it wouldn't have taken 8 years to deploy this product. It seems that we hear the same issue every time we talk about a VA IT modernization effort. Poor requirement development, poor change management, poor governance structures. Millions of dollars spent on programs that doesn't meet VA's needs. It's long past the point where we must have a conversation about why the VA cannot learn from its past mistakes. Veterans, VA employees, and the American taxpayers deserve better than this. Further, I remain concerned about the future of this project in light of the nearly 50% cuts to the VA's IT modernization budget. When we pit modernization efforts against each other for funding, it's not just the infrastructure or VA employees that face challenges. It's a disservice to veterans as well. Finally, I have concerns since I joined this subcommittee about some of the other choices that the VA has made. While modernization is necessary, we cannot leave out our less tech-savvy or our lower-income veterans behind. There are many who do not have access to smartphones, laptops, or even home internet. Because of this, VA's decision to remove the kiosks and limit the paper filing of claims has caused undue stress on some of our most vulnerable veterans. I look forward to continuing to work with VA as they deploy further strategies to engage both veterans and VA employees with technology and improve data collection for both VA and the community care providers to ensure timely and correct reimbursements to veterans. I would be remiss if I did not mention the importance of VSOs partners here as well. Our VSOs often play a key role in facilitating veterans' interaction with VA healthcare and benefits. I look forward to hearing from DAV today and how they and their members feel BTS3 rollout has been going. Thank you, Mr. Chairman. I yield back.
Thank you, Ranking Member Sheriff-List McCormick. I will now introduce the witnesses on our first and only panel today. First, from the Department of Veterans Affairs, we have Mr. Ryan Hyman. Okay, Mr. Ryan Hyman, the Deputy Executive Director for Member Services in the Veterans Health Administration. We also have Mr. Benjamin Williams, the Director of Veterans Transportation Program. We have Ms. Carrie Lee, the Deputy Chief Information Officer for Product Engineering. And finally, we have Mr. John Retzer, Assistant National Legislative Director for Disabled American Veterans. I ask the witnesses to please stand and raise your right hands. Do you solemnly swear under penalty of perjury that the testimony you're about to provide is the truth, the whole truth, and nothing but the truth? Please let the record show that each one has responded in the affirmative. Thank you very much. Mr. Hyman, you are now recognized for 5 minutes to deliver your opening statement on behalf of the VA.
Chairman Rosendale, Ranking Member Sheriff-List McCormick, and members of the subcommittee, thank you for this opportunity to appear before you today to discuss VA's Beneficiary Travel Self-Service System, or BTS3. I am joined today by Ms. Carrie Lee, Deputy Chief Information Officer, and Mr. Ben Williams, Director of the Veterans Transportation Program. The Beneficiary Travel Program is crucial for eligible veterans providing essential travel reimbursement and transportation services to ensure access to necessary health care. It addresses the financial and logistical challenges of travel for medical care by reimbursing eligible veterans for expenses. The program enhances access to medical appointments and reduces their financial stress. With the introduction of BTS3, VA transformed the travel claim process, providing veterans the ability to submit claims online 24/7 by 365, and improving the agency's ability to pay eligible veterans correctly. The BT system underwent phased implementation with testing in July of 2020 and national deployment from September to December of 2020. During the transition, claims processing time increased due to manually scanning paper claims. To manage frontline challenges with the adoption of a new system and during the COVID-19 pandemic, VA extended the legacy system alongside BTS3, delaying this full implementation but allowing for user experience enhancements. During this same time, VA imposed a 10-day inventory goal in March of 2021 to improve efficiency and visibility of open BT claims. VA closely monitored critical performance indicators and redesigned the BTS3 rules engine to improve efficiency. By December of 2023, the BT system became the exclusive solution, offering self-service options, automated rules engines, and internal controls to ensure proper payment. VA has made significant improvements to the BT system in response to the 2023 OIG report. The report identified 4 key areas that had not been met, including auto adjudication rate, veteran feedback, legacy system decommissioning, and the reconciliation of duplicate payments. All but one of the OIG recommendations have been remediated and closed out. The remaining recommendation, related to auto adjudication, was launched this past month. Stakeholder feedback has been crucial in identifying areas for improvement within the BT system. Since October of 2023, VA has received over 11,000 veteran surveys, with the most desired improvements being claims automation and process simplification. 80% of those survey respondents have been identified as over the age of 50. Recent improvements instituted as a direct result of this feedback has shown 17% increase in ease and simplicity of use, as well as a 16% increase in overall satisfaction. Instituting a veteran-centric approach, VA is continuing to enhance the system's design, functionality, and user experience through fiscal years 2024 and 2025. Two of these planned enhancements include the expansion of the system's text-initiated claims submission process and integration of the travel claim feature to the VA Health and Benefits mobile application. The veteran-facing experience of the BT system will also be transitioned to va.gov platform over the next 18 months, providing seamless integration with other digital health solutions. Chairman Rosendale and Ranking Member Phyllis McCormick, thank you once more for the opportunity to speak with you today. VA remains deeply committed to expanding self-service options and streamlining the BT reimbursement process to enhance the overall healthcare experience for veterans. We value your ongoing engagement as we embrace our shared responsibility to better serve those who have served. My colleagues and I are prepared to answer questions that you may have. Thank you.
Thank you, Mr. Hyman. The written statement of Mr. Hyman will be entered into the hearing record. Mr. Retzer, you are now recognized for 5 minutes to deliver your opening statement on behalf of DAV.
Thank you. Chairman Rosendale, Ranking Member Phyllis McCormick, and members of the subcommittee. DAV is pleased to offer our perspectives on the VA beneficiary travel self-service system. VA launched a web-based system in September 2016 to automate travel reimbursement claims, reduce costs, and mitigate payment errors. In November 2020, VA transitioned from the travel reimbursement kiosk machines at VA medical facilities to the self-service system, computer-based program nationwide. According to the May 21, 2023 Office of Inspector General report, the program office took almost 5 months after the system launched to provide veterans and veteran service organizations training on entering claims in the self-service system. VA only sought feedback from a small group of veterans who worked in the program office during the system development, which excluded both veterans and veteran service organizations. Many veterans have expressed disappointment in the new system and noted that the current enhancements are not user-friendly, lengthy in time, and delay timely travel reimbursement. Currently, veterans have a va.gov or My Healthy Vet account, must go to 2 logins to 2 sites, 4 screen changes just to begin the new travel reimbursement process. We appreciate VA is trying to address the issues to streamline these processes with a one site, one password access. However, it is important to address the system delays, multiple screen changes that add to lag times, and the need for verification when appointments are not at the VA medical centers. However, Chairman Rosendale, not all veterans appreciate the self-service system. Veterans want the option to file their reimbursement claims at the medical facilities. Although we appreciate the innovation of mobile text features for reimbursement, it has presented challenges in some locations due to lack of staffing knowledge or facilities not being enrolled in the new process. To enhance the self-service portal usage, it is recommended that the Veterans Health Administration engage in outreach to veterans and the veterans service organizations, actively seek feedback, and assess the need for system changes based on the feedback they receive. Veterans have shared with the DAV recommended changes should include the return of the kiosk at all medical facilities, on-site computer access for filing beneficiary travel claims for those who have access, and direct assistance at the front desk for submitting reimbursement claims during check-in and check-out for appointments. DAV recommends all VA facilities should improve their signage and communication of their resources to assist veterans to on-site computers that can access self-service system or other facility resources to file their claims. As VA considers improvement to the self-service system, we remind VA that there are veterans who lack access to personal computers, laptops, tablets, smartphones, and adequate bandwidth. Also, many veterans lack familiarity or comfort with online web-based technology. DEV recommends the department improves on-site real-time services by integrating necessary data and banking information from the Veterans Benefits Administration to the Veterans Health Administration. Additionally, deploying digital signature pads and on-site ID verification technology can expand and enable the medical facility staff to use internal access to the self-service system in filing digital reimbursement claims for veterans who have difficulty filing through the web-based program, and eliminates the paper claims form process, which delays timely receipt of the reimbursements. Chairman Rosendale, although we appreciate that VA is working to improve these issues in beneficiary benefits travel reimbursement program, simply addressing the self-service innovations for veterans is not enough. The VA travel mileage reimbursement rate has not kept up with the rising gas prices and the cost of auto maintenance and insurance. As a result, these expenses can hinder access to care for some veterans. Currently, veterans' mileage reimbursement rate is at 41.5 cents per mile compared to the Government Services Administration rate for government employees currently at 67 cents per mile. In conclusion, we urge the Secretary to exercise his full authority and align mileage reimbursement rates for veterans with government employee rates while also ensuring subsequent changes stay in line with changes of the Government Service Administration rates in the future. Chairman Rosendale, this concludes my testimony, and I'm pleased to answer questions you or members of the subcommittee may have.
Thank you very much, Mr. Retzer. The written statement of Mr. Retzer will be entered into the hearing record. We will now proceed to questioning, and I will recognize myself for 5 minutes to kick this off. Mr. Williams, is the BTS-3 system working as it ought per the contract requirements?
Thank you, Chairman, for the question. I will get this started, and then I'll pass to Ms. Lee, as it is an OINT managed contract for the design and sustainment of the system.
Could you bring your microphone just a bit closer to your mouth, please?
Yes, sir. Better?
Little bit.
I'll speak up. How about that?
Thank you.
Yes, sir. So the system is working as designed currently. And I don't have issues, and I feel that
You say it is acting as per the contract requirements?
it is operating as designed from the VHA perspective.
Is it acting as per the contract requirements?
I will have to defer to Ms. Lee for that, to answer
Thank
that
you.
question.
Yes, the system is acting as required by the contract. The system was developed based on the requirements that the government gave to the contractor.
So the contract requirements allow for 40% of these claims to be adjudicated, and the goal that you said is 80%, and the contract literally allows for only 40% of this to be done? If that is the case, then we've got a serious procurement problem here. So is that the case? The contract allows for a complete inefficiency, ineffectiveness?
I will need to take that for the record because I do not know the details of the exact contract.
Well, then please don't comment, okay, when I ask, is it functioning as per the contract requirements if you don't know what the contract requirements are? I don't know is acceptable, but find the answer out for me, please.
Will do.
Thank you very much. Mr. Williams, how much has the VA spent on this project, including the contract and any other costs to date?
Sir, I'll defer to Ms. Lee on that as well.
Ms. Lee,
To
go ahead.
date, the estimated amount spent is $36 million.
Excuse me?
$36 million from the
Okay,
time the
$36
project's-
million. Does that include all the extra staffing, the 140 staff that have been placed on as well?
That includes, that's the cost for the IT system. I would have to pass to my VHA cohorts for the VHA costs associated.
Okay, so we've got 36 million for the software program itself, where that does not, am I assuming, that does not include the additional expense for the 140 extra staff?
That's correct.
Okay, and we originally were supposed to be at $11 million, correct?
That's correct.
Okay, so quick math, a four-function calculator. You're already 3 times what the original cost was estimated to be, and it's only doing 40% of what it was supposed to, correct?
For the automation portion, yes. For the record, I would also add that one of the really great benefits has been the associated improper payments that 5 years ago was at 25%.
I see that, and as a matter of fact, I was looking at those numbers, and while it is at, in 2019, it was 18.79%. In 2021, it was almost 14%, and now we've got it down to 6.83%. That sounds like a really great achievement. The problem is, in 2021, it was 123 million, and in 2023, that 6.8% translates into 120 million. So don't stretch your arm patting yourself on the back, okay? You save $3 million. Percentages are very attractive, but dollars are what this committee is concerned with. Before I go into anything else, I'm going to go ahead and yield 5 minutes to Ranking Member Sheriff-List McCormick so she can begin her questioning.
Thank you, Mr. Chairman. Mr. Hyman, in our May hearing on the IT budget, VA witnesses noted that they felt that the budget request was sufficient to keep all its IT modernization efforts moving forward at the same pace. How does the VA plan to manage the upkeep and implementation of the new BTS-3 technology and ensure that VHA staff are prepared to effectively address challenges in the claims process?
Ranking Member Sheriff-List McCormick, thank you for that question. For the first part, I will say that we have a very strong partnership with OI&T, and we feel very confident. I will let Ms. Lee speak to that portion for our out-year plan. But as it relates to maintaining the claims volume, really important work is being done, and I mentioned it as part of our OIG recommendation that they gave to us to improve automation. So we are approximately at 46%, as the chair had referenced, but we deployed that release May 30th. And most recently, over the course of the last 10 days, we have seen that auto adjudication rate raise as high as 70–80%. So we're really excited. We're continuing to monitor that, of course, but that is a very large workload that is being processed then by the system as it was designed. Ms. Lee.
What did you change?
I'm sorry, so what did we change as for the release? Yeah, so what the release was is in association with the rules engine and how a veteran's claim essentially bounces against different requirements that we have in order to be able to process that effectively and eventually pay that claim. And so those improvements, as we've learned more about the system and have been able to build additional capability in, is what has made that improvement to the automation.
Did you lower the requirements?
No lowering the requirements. I think we had very strict, very strict requirements. And the intent, again, originally because of OIG's recommendation many years ago, was in part because of the paper claim challenges and those volumes that was difficult to track. So the system itself has been able to be improved, I would say. And truth be told, you can look no further than our improper rates that are holding as we continue to make these updates.
And do you think that BTS-3 has enough funding to address the issues with latency and the login struggles that we've heard about by our veterans?
Yeah, to your first question, I'll ask Ms. Lee to talk about 24 and 25 and then also cover any latency.
Yeah, so as part of our PACT Act efforts, and thank you for the PACT Act, we are modernizing the BTSSS system and using the TUF funding to help with those modernization efforts. As you know, our current congressional budget we're making trade-offs, and since we have the PACT Act authority, we are able to use that TUF funding to be able to make additional improvements where our base budget doesn't have enough funding.
Now, this question is for Mr. Hyman. Mr. Reed's testimony, we heard about many challenges that the veterans are facing in accessing BTS-3 and technology in general. I was glad to hear that the veterans had an option to utilize different modalities for submitting travel reimbursements. With an increased focus on BTS-3 and the kiosks' usage, how does VA plan to continue bridging the digital divide?
Yeah, absolutely. I'll touch on probably a couple topics here, but we have recently integrated also with MyHealthyVet. A lot of veterans like MyHealthyVet. They use it for various different reasons to interact with their healthcare experience. And BTS-3 is also now integrated with MyHealthyVet, so they can log directly from their MyHealthyVet account. As you mentioned, kiosks, it's been mentioned a few times, and we know they are or had been popular. While my office doesn't own the properties of the kiosks necessarily, we have pressed forward to integrate with the kiosks that do exist out there. In fact, there's 38 VA medical centers that's...
So I only have 16 or 15 seconds left. I just have a real quick question. Are there any methodologies that you're evaluating?
Yes. So we have, through the Digital Health Office, we have a multidisciplinary team, OINT is included in it, Veteran Experience Office, and we are looking at what we would call on-premise devices and how those may be best used in veterans' healthcare, how they can interact with those.
Thank you. I yield back.
Thank you very much. I now recognize Representative Self for 5 minutes of questioning.
Thank you, Mr. Chairman. Much of what we deal with on this committee is frankly leadership decisions. Mr. Williams, how long have you been in your position?
Thank you for the question. I started with the Veteran Transportation Program in March of 2019.
Okay. Very good. I'm curious about your decision to go exclusive in December of 23, I think it was. Why did you make that decision with the lack of, why didn't you do a soft opening? Why did you make that decision with the lack of testing that you did?
So, sir, for clarity, we did operate both processing systems, so the legacy processing tool in Vista, as well as BTS-3. We operated those simultaneously from 2021, from the inception of BTS-3 until December of 2023. We felt that was a very smart move by leadership to be able to leave the legacy system open, which some facilities and some staff prefer to process in, especially during the COVID pandemic, and some of the administrative staffing challenges that all businesses had during that time. As we continue to move forward and the system started to pick up pace as it pertains to usability, and we were able to address some of the staff as well as some of the concerns from veterans about the system. In addition to the IG's recommendation to decommission the legacy tool, that's when the agency made the determination that it was time to go exclusively on the processing side to BTS-3.
Well, several of you have mentioned the age, the lack of technology skills, if you will, with the veteran population. Do you stand by that decision to go exclusive, knowing the issues that the population had?
So I do. I think it was very important to mitigate some of the risk of duplicate payments, as well as to ensure that across the enterprise we were able to take advantage of the internal controls that the system provides. And so I do think it was the right decision. Again, from a processing modality perspective, it does provide us the ability to ensure we're making proper payments to veterans. And when you look at the entire population of claims across the enterprise, we are making 83% of those payments for those claims within 10 days, and 90% of those claims are being paid within 20 days.
Yeah, I don't have time to ask the next question, but obviously, the concern here is with rural districts. You've got some members here. And just consider, did you do any consideration for rural districts? I don't represent, well, I do, but not as rural as some of the members. You started off requiring 62 individual rules, all be perfect. Walk me through how you have loosened those rules very quickly.
So we did a rules engine redesign to smartly, I'll say, compartmentalize, and
Did you prioritize the rules?
yes,
All 62?
yes.
Okay. There's an old adage in business: price, speed, and quality. You only get two. Mr. Hyman, which two did you prioritize at the beginning, and which two do you prioritize today? Price, speed, and quality. You only get two.
Yep. So I think we chose quality and price, and I think we are starting to feel the effects of speed and quality as of lately.
Yeah, I would disagree with your original prioritization. I think you prioritized speed and sacrificed quality, but that's arguable. And Mr. Hyman, you heard Mr. Retzer's solutions. How much would they cost? Ballpark.
I would have to defer that to Ms. Lee. I'm not sure on some of the technologies that he was.
I think I will submit that question for the record, because I'd like to, you can obviously get his testimony. I'd kind of like to see a ballpark of his solutions. With that, Mr. Chairman, I yield back. Thank you.
Thank you very much. I will now recognize Representative Landsman.
Thank you, Mr. Chair, and I want to talk a little bit about performance measures and the kiosk. I'm from Cincinnati, and Hamilton County, we've had issues with transportation and getting veterans where they need to be, and of course, you know, their ability to get reimbursed and reimbursed quickly is a part of that. The contract, you all started the process in, as I understand it, 2016, full implementation maybe 7 years later in 2023. I don't know if that is normal or slow, but that does seem like a long period of time, but maybe that's how long it takes. And you know, did test. The 23, did you say 23 or 30? How much did you say, Ms. Lee? I know it didn't include staffing, but the cost itself?
36 million.
36.
That's from 2016 until present.
Yeah, so $36 million. Again, don't know if that is, you know, based on the scope, a good number. What I did see that was very alarming was the time it's taking before, my understanding was that the items would get processed in a couple minutes, and now it's anywhere between 7 and 12 minutes to get processed. I'm not sure if that's true or not. I'm curious, and this gets at the chair's question about performance measures. Not, obviously, I'd love to know the contract-related performance measures, but does BTS 3 have performance measures? What are those performance measures, and what are the most important ones in terms of getting better at ensuring that veterans get reimbursed in a timely manner? A, B, I know that kiosks is not your department, Mr. Hyman, but I would just ask that we get some additional kiosks. You know, how do we request kiosks? You know, not to be you know, selfish here, but I'm wondering how we get more kiosks. So can we do the performance measures first, and then see if I can't get us a kiosk?
Yeah, thank you, Representative Landsman. I think I got most of it, but if not, you're welcome to follow up too. So we definitely have performance metrics. Quite frankly, your area of Cincinnati is doing quite well, under a 10-day processing time on average. which is great. And I would say that that is true of really the entire landscape of VA, across all of VA medical centers. We are again paying, as I think Ben referenced earlier, to the tune of 80% of all claims within 10 days. And when you look at the 20-day mark, it's over 90% that we're able to pay within that 20 days. So we have many metrics. Obviously, the auto adjudication we've talked about. We also look at veteran utilization in that space. So we have many metrics and are happy to share that with the committee as well. To the cost.
Just because I want to make sure it's on the record, if I would love that to be submitted to each of the members, all of the performance measures. Thank you.
Yep. And then to the cost, I understand that there was some concerns about $36 million, but to the tune of improper payments, we're saving $90 million projected a year. So the math on that certainly does add up for us. And then as per kiosks, great question, popular topic. Again, we are looking at on-premise devices. I will say currently we have 38 facilities. There's 754 kiosks out there. Okay, so we do have kiosks. They're not at every VA medical center, and we definitely hear that from congressional members, from our partners in DAV and otherwise. We have a team that is assessing what that will look like in the future and how we make sure the veterans have devices in their hands that they can interact with their healthcare.
If and I suspect others will feel the same, what is the process about, in terms of engaging you all and getting additional kiosks? It is a very popular tool.
I don't know the formal process. I think you certainly can request for the record, I guess, that we give you what we have on the roadmap. We are planning to provide some recommendations to VHA leadership as well.
I think in addition to the recommendations, I'll request, as many as we can for our district and our veterans. Thank you. I yield back.
Thank you, Representative Landsman. Mr. Hyman, that's great. We're hearing about how great and wonderful this system is working, but again, 4 years later, 45% of travel reimbursement claims are submitted electronically in BTS 3, 45%. And only 52% of claims are adjudicated automatically without manual review. So while the veterans are getting their compensation back, I have to think that that's due in part to 140 extra employees there to help our veterans through the system. Mr. Williams, is the plan to keep paying the contractor? We are $36 million into an $11 million contract. Okay, is the plan to continue to keep paying the contractor until they get it right? Because we're 4 years into it and it's not right.
Sir, I'll have to direct that to Ms. Lee.
So the contractor work is guided by VA employees, and so we will continue to work with the contractor to make improvements, but it is the VA employees that are providing the requirements, and so they're building toward those requirements.
Okay, so I'm going to need.
On our roadmap.
Okay, I am going to need, and whoever gets that, whether it's staff or whether it's Ms. Lee, I need a copy of this contract, okay? And I need a copy of the matrix because I want to be able to see why in the world we have yet another vendor who's getting enriched to the tune of millions of dollars while they're not delivering the system that we're supposed to have. Mr. Williams, BTS 3 was created in part to process more travel claims with fewer people through automation. But according to the OIG report, VA had to hire 148 employees to manually process the claims and deal with the backlog created by BT3's failed auto adjudication. What are those 148 employees doing today?
Sir, they are currently processing the paper claims that are
Okay,
still.
so they're inputting this stuff manually.
Yes, sir.
How much money has the VA spent to hire employees to compensate for the system's failings? Can anybody give me that?
We can get the cost of those team members that were.
Okay, so we want to get that 148, what the costs associated with them, both their current, when they started, so that we can see exactly what the system is, because clearly the 36 million is not covering what the true expense associated with this is. Mr. Williams, wouldn't it be better to place those employees in the medical centers to directly assist the veterans with their travel reimbursements, as Mr. Retzer actually recommended?
Yes, sir. Chair, we agree with that. So we are working with the facility leadership to ensure that we free up as many resources.
So my question is, are we going to place these employees actually in the centers, or are we going to bring another round of employees, leave the 148 at whatever facilities they're at now for inputting all this information, and then bring another round of employees to place them out into the facilities themselves?
No, sir, we are not bringing in another round of folks to do this.
So we're looking at dispersing these 148 individuals out into the facilities?
They are at the facilities currently, sir.
Okay, I would like to see the list of, I don't need names, but I want to see the list of the facilities that have these extra people that are dedicated towards exclusively helping our veterans get this travel program reimbursement back. I want to see where they're located, how many there are, and so that we can see what facilities are still lacking and don't have that. Wouldn't it be more economical to keep the kiosk based on all these numbers? Mr. Hyman, Mr. Williams, whoever would like to.
Yeah, I will say that the legacy kiosk prior to our integration just spit out a piece of paper for somebody to process in an office. So now, it is integrated. The kiosk that exists today, we have integrated to where that information that they're putting in the kiosk goes directly to BTSSS. But 5 years ago, that wasn't the case.
Mr. Williams, how do you measure the veterans' dissatisfaction and the cost imposed on them by BTS3 and the lapses when they don't receive their funds on time?
Sir, I don't think that we can specifically measure that, but I can tell you that through work that we've done since implementing the system and getting veteran feedback, as well as partnership, my team, our team met with Mr. Retzler a month or so ago, and we're attending all eight of the VSO conventions this year. By that continued partnership, listening to the VSOs, working with them on a regular basis, as well as taking the feedback directly from veterans to use to prioritize the changes to the system.
I would include Mr. Retzler in those conversations because he seems to have his hand on the pulse. With that, Ranking Member Sheriff McCormick, I yield to you.
Thank you, Mr. Chairman. I wanted to go back, Mr. Hyman, to the conversation about the kiosk replacement. What role does the VSOs or veterans have in the decision-making?
Associated with kiosks, I apologize. I think that we have a strong partnership with many of the VSOs. I would say that probably along the decision-making process, I'm not sure that there's an active requirement there, but.
So do they play no role? I'm trying to figure out, because they have, the veterans are trying to access, they prefer the kiosks. The VSOs have also been in the process. And so their partnership in it, does it have any role in any decisions that are being made?
Absolutely, yes, absolutely.
And so what is that role?
Similar to as Mr. Williams had mentioned, we met, I think, beginning of May, and previous to that, we had met with Mr. Retzler, I believe, in February. So that continual, those listening sessions and being able to understand, because, for example, DAV has a tremendous reach into communities across this country for veterans. And certainly, we take note of that, and many of their recommendations are things that we're working in partnership with.
And Mr. Ritzer, what should that role be?
Thank you for that question. I think one thing, it is true, just this year, however, it's a little late. We would have preferred it up front before the development happened, that they engaged us so that we could express the needs of our veterans, but they have engaged since February, and we've met 2 to 3 times already, and we've proposed some ideas with regards to improving the system. One of the things that's really challenging is, and this gives light to what, the committee is looking for, our veterans really want this. Like DAV, we have over 1 million members, and this is one of our resolutions we voted on in August of last year, that the BTS system must be improved. So it shows you that this is really important to them. And at a cost of what it may be for them to make it, we need to make sure that VA understands they should not have replaced the system in full. They should have kept things that were working in place for our veterans. And they need to be reminded that our veterans are aging. So that's another barrier that's happening. As our veteran population ages, technology is not comfortable for them. So they want to be able to have VA do the customer experience, the veterans experience for them. So we're going to work and continue to work with the VA to help them. And we do wish to be more involved in rule basing. Because one of the things that we're hearing about the rule base is when we know most of our veterans are just getting mileage reimbursement. That mileage reimbursement is about point A to point B and back to point A, home to facility and back home. They may alter that choice, so the automated decision process has then been kicked out if there is some extenuating circumstance that you're not using the primary direction that was set up in the system. That should not be. That's a barrier. They need to remove barriers like that out of the system, so they need to relook at their algorithm. But the best way they're going to get those algorithms is by talking to veteran service organizations and veterans.
Mr. Hyman, how is the VA measuring utilization rates with their kiosks? And how is the VA using the data to bolster kiosk usage as it reintegrates these technologies back into the VA MCs and other VA facilities?
Yeah, thank you, Ranking Member. The utilization rates for the kiosks, now that we have a BTS integration, is able to be tracked. That's one of the good things about the integration. We can tell what percentage of claims are being entered through the 38 sites that have kiosks of those 754 kiosks that exist out there. It ranges across those sites that do have those, but that is something that certainly we can get if you have interest in a particular area.
This is for Mr. Ritzer. One of the barriers towards enrollment that OIG identified was issues with Access VA, which in some cases led to veterans not signing up for our utilization or utilizing these benefits. Can you share more about how these barriers impact veterans' usage of BTS-3?
Yes, barriers that exist are digital divide barriers up front. That is one of the issues that we have, like I said in my testimony in the written and oral. They are challenged, but one, with access to technology and its bandwidth. I was just in Iowa and this past weekend talking to our members out there who are in rural and also in metropolitans. They are not satisfied with the BTS-3 and the way it is functioned because of these barriers. They're also challenged with the technological requirements that require them to have accounts. ID.me, they spoke about how they are not appreciative of how ID.me is restrictive and how confusing it is even to set up an account. And also that the fact is that the system is in two worlds. We appreciate the fact that VA is working on improving it, but they need to have a solution now for our veterans because they can't wait for their reimbursements. So we need to ensure that technology and legacy process are working together seamlessly for all of our veterans rather than thinking a one-size-fits-all concept.
Thank you. I yield back.
Representative Self, I recognize you for 5 minutes questioning.
Thank you, Mr. Chairman. I've been listening to this conversation about paper kiosks, BTS-3. In your own testimony, Mr. Hyman, you gave us a chart. For all of the talk about kiosks, a very small percentage of claims are put in through the kiosk, and that might be the number. But more importantly to me is you list the 23 VISNs, and only 9 of the 23 still use more paper than BTS-3. In fact, 8. Only 8 of the 23 is it primarily BTS-3. So how do you explain that? Is because you've only got 104. I'm trying to figure out how you're managing these 3 because you've only got you've added 140 odd employees to help with paper, and yet you say they're integrated from the kiosk, and yet BTS 3 doesn't have a majority of the submissions even yet. So somebody explain to me, I mean, your percentages look like you're making improvement. This chart that you gave us doesn't suggest that. Mr. Williams or Mr. Hyman, either one of you?
I'll let Mr. Williams, but I want to start with, in that particular chart, the kiosk figure that you see at the top there. Those percentages, in fact, are BTSSS. We broke those out so that we could identify how different sites are using them, and that's also why you see some that don't have them, because the kiosks are not in every VISN and every medical center.
So do the 140 employees, do they go to the kiosk to help? Where do they work? I know you've got them spread out. I can't figure this chart out.
Yeah, the 140 do work across the country. And more or less, I would call that more of a tiger team, but they are in place permanently, and they are working claims from all over the country, anywhere where there might be challenges with processing time or adoption of the BTS system. There's also staff turnover. These are frontline team members, GS.
Okay, so what is your plan to cut down on paper? I assume you have a plan to cut down on paper.
Yeah.
Because BTS 3 still has a minority of the VISNs input their claims through your automated system.
Yeah.
And this is claims submitted. We're not talking about adjudication. We're talking about submitted. So it looks to me like the system is still in its infancy.
Yeah. One of the things that I'll let Mr. Williams speak to, and it's something that I think we spoke with Mr. Ratzler many times, and that's associated with an outreach and communications plan. So Ben, if you don't mind touching on that real briefly.
Sure. So you are correct. And I'll say 5 years ago, 100% of our claims were paper. And while we have seen, I'll say across some VISNs more than others, adoption, higher levels of adoption, we felt strongly with OINT that we needed to adjust the veteran portal where veterans log in to submit their claims. That, as was mentioned earlier, is migrating to va.gov and a simplified claim submission process. As Ms. Lee mentioned, that will be a unified platform where veterans can manage their profiles, their individual claims.
Now, wait a minute, Mr. Williams. In Mr. Hyman's testimony, it says, as you were just mentioning, transitioning the veteran-facing user experience of BTS3 into va.gov over the next 18 months, providing tighter integration with other digital health features, such as managing appointments. It sounds to me like you're adding complexity to it rather than simplifying it over the next 18 months. Which is correct?
So we are not adding complexity to BTS3.
But you're providing...
Just to clarify, we're adding the veteran portal portion where veterans submit their claims. We're adding that as a modality on the va.gov platform.
I'm out of time, but I fail to see how making more changes to a system that looks to me to be in its infancy is going to make things better. With that, I yield back.
Thank you very much, Representative Self, and I agree. And you are spot on time, Representative Hageman. Can you dive right in? We'll give you an extra 15 seconds or so here to get yourself organized. How's that? Okay. I yield you 5 minutes for your questioning. And thank you for joining us.
Well, Mr. Chairman, I greatly appreciate the subcommittee for allowing me to join today's hearing to discuss this critical issue that continues to affect our veterans in both Wyoming and across the country. Decisions made here in Washington, D.C. by our bureaucratic agencies have the most profound impact on the livelihood of millions of Americans, and a one-size-fits-all approach is hardly ever a viable solution. While I ultimately believe fundamental reform is desperately needed in the realm of agency decision-making, until then, proper notice, communication, and outreach, along with providing an accessible and timely mechanism for soliciting feedback, must always remain a core responsibility for each and every one of our federal agencies. According to the May 2023 OIG report entitled Goals Not Met for Implementation of the Beneficiary Travel Self-Service System, one of the key findings was that, quote, during system development, the Veterans Transportation Program only solicited feedback from a narrow group of veterans who worked with the program office, excluding both veterans not employed by VA and veteran service organizations, end quote. While I understand the VA has taken steps to address this oversight, it is clear that the failures identified in the report have continued to inhibit the system's overall success. Mr. Williams, would you agree that it is a foundational responsibility for the VA to conduct overreach and solicit feedback from our nation's veterans, veteran service organizations, and other relevant stakeholders prior to implementing large-scale operational changes?
Yes, ma'am.
And could you elaborate on why the Veterans Transportation Program Office did not properly solicit feedback when the new system was in the development stage versus after the system was implemented on a national scale?
So I cannot say it was prior to joining the program for myself, but it is a commitment of ours currently and has been, we've been working on vastly improving since 2021. There's been substantial increases both on the IT side as well as on the VHA side of the house to collect feedback from veterans.
Well, the program continues to fail our veterans. And I know that from just visiting with one at a reception that I was at, but also in learning and talking with our veterans in the state of Wyoming. And wouldn't you agree that in order to mitigate errors and guarantee the most successful outcomes, that proper input and feedback from those being affected should be completed beforehand?
Yes, ma'am.
The same OIG report also found that, quote, the program office did not provide training to veterans on how to enter claims in the new system until almost 5 months after the system launched, end quote. Mr. Williams, can you explain why the Veterans Transportation Program Office did not provide proper training to veterans on how to submit claims into the new system until almost 5 months after it was rolled out?
Yes, ma'am. So the intent, and as with a lot of applications, currently there's on-screen help. So the strategy at the time and the decision at that point was to allow the on-screen help to be the guide for veterans.
Do you think that that's going to be adequate for our older veterans?
No, ma'am, it's not.
Do you have knowledge of the particular background or number of veterans who missed out on reimbursements due to training not being available until well after the rollout of the new system?
No, ma'am, I don't.
Can you get that information to us?
We will do our best to be able to isolate that in terms of veterans who may have been submitting prior to the rollout and who didn't following.
Is your office following up with veterans who are having trouble with the program and making sure that they're receiving the benefits to which they are entitled?
We do have a help desk that we track and that we resolve questions that veterans have on how to submit claims and ensure that and follow through to resolution on that. In terms of as we mentioned earlier prior to your arrival, we are establishing a multi-pronged approach to collect and get feedback from veterans as well as resolve their issues if they continue to have them.
Well, and I'd like to quickly focus my discussion about the reimbursement kiosks from VA medical centers. My home state of Wyoming holds over 40,000 veterans and is one of the most rural in the nation. It is not uncommon for veterans across my state to travel significant distances to reach a VA facility, and accessibility to reliable internet is also a luxury that is simply not always present. Mileage reimbursement kiosks provided all veterans, including those who did not have the best internet connectivity or lacked familiarity with the online applications, with an easily accessible option for submitting their claims upon arriving at a VA facility. Unfortunately, these kiosks were removed from the VA medical centers in my home state. Mr. Hyman, how were the veterans in Wyoming consulted prior to this decision?
Thank you, Representative Hageman. I'm not sure that they were contacted to that degree.
Thank you. We need to do better. With that, I yield back.
Thank you very much, and thank you again for joining us today. Ms. Lee, we've got a goal, your internal goal is at 90% for the auto adjudication rate, and yet we're still sitting at this 40%. Does the VA understand why the auto adjudication rate is so low? Can you like pinpoint what is causing this?
So we did a thorough review of the rules associated with auto adjudication, which was completed in February of 2024, and made changes to the rules engine to make it more efficient and to auto adjudicate more claims without manual intervention. That was rolled out on May 30th, and I think it was either Mr. Williams.
So is it the system, or is it the people that are using, or for that matter, not using the system? Have we identified the problem, is what I'm getting at?
With auto adjudication, it follows a certain set of rules, and it was the rules.
And this is the 62 rules that we were just
Yes.
talking about? Okay.
Yes, and we just redesigned that, which was deployed on May 30th.
Because I can tell you, if I was working on a software program, and I'm not completely technically illiterate, and I had to go through 62 steps in order to try and figure out what my compensation was going to be just to get from point A to point B, you would have lost me at about question number 6, I can tell you. And then the next call would have been to the VA, to one of these 148 other facilitators, I think we should probably call them, to help us figure out why in the H this is such a cumbersome process to get me reimbursed for my travel to get my health care. I understand what you just walked through, quite frankly, a convoluted statement about how you're going to fix it. I understand VA decided to loosen the system rules because the auto adjudication rate was so low and so few veterans were receiving their travel reimbursements in a timely fashion. Which system rules did you decide to loosen, and what was the process used to select those rules that were loosened, and how did you loosen them? So it's a 3-part question. Which rules did you loosen? How did you make that determination about prioritizing which ones were going to be loosened? And what do you mean by loosen them?
So I will pass this on to Ben because it was the program office who is the one who defined what the rules should be.
Thank you, sir. We will provide you the list of the rules that were changed. I don't have them off the top of my head.
Do you have the criteria that you used that you could discuss and say what was the process in selection?
So as we looked at the rules, frankly, we were looking at what portion of claims, the largest portion of claims that we could impact safely. So as you look at one of the main goals of the reason to implement the rules engine was to establish controls around paying eligible veterans the correct amount, right? So when
62-part question. When I'm going from here to my home and back to get health care, I'll be honest with you, I can't even fathom anybody going through that. And I just had a note brought to me that the 2021 VA study of veteran population, the average age is 61. I'm 64, okay? 90% male, 36.2% Vietnam era, 30.4% post 9/11. So that means we're somewhere in the 36% plus, 30 is post here. So we've got at least 50% of the population that's Vietnam era or older. 50% is Vietnam era or older, based on my information here. Do you truly believe that they're going to sit down in front of their computer, if they have one, and go through a 62-step process to figure out how they can get reimbursed for going to seek their health care?
Thank you.
You do? Yeah? You just said yeah?
Thank you for the question. So what I would say is that the complexity, some of it's in the law, and quite frankly, veteran eligibility is one of those factors of the 62 that we have to check every single time, right? There also has to be a trip that's completed, and then there has to be the completion of the appointment. Those are the three basic areas of those rules that touch on.
So why do
it
we
is
have
complex.
62 parts then that we're going through instead of those three questions saying, did you go there? Doctor signs a slip. We know that it's 420 miles round trip in Montana from your home to the doctor's office. My time has expired. I'm going to yield to Ranking Member Sherfless McCormick.
Thank you, Mr. Chairman. Mr. Hyman, during the pre-hearing briefing, my staff heard that the VA is taking steps to automate the processing of travel claims for approved community care appointments. How different is the process through BTS-3 for community care appointments versus VA healthcare appointments? And are there any snags that often occur in this process?
Yeah, thank you for the question, Ranking Member. The difference in the layman terms for myself, who's not all that technically savvy, but the main difference is really the fact that we on VA do not have access to every single one of the community providers that are out there. There's many, probably thousands, if not more, and that is one of the biggest challenges, is not being able to quantify if that appointment actually happened or if it was canceled or what actually happened.
What are the main snags that occur in that process?
The main snag for a veteran, I guess, would be that the fact that if they're getting community care, it's a little bit challenging for our team to quantify if that care actually occurred.
Okay. Mr. Hyman, my next question is, we appreciate the VA being proactive during the development of BTS-3 to create goals to measure success. This is not something that we've seen VA do well often. However, without enforcement mechanisms, these goals are just goals and not effective assessment tools. I understand that the VA has taken steps in moving the needle closer to these goal matrices. How does the VA plan to ensure that these goals are met and are creating better outcomes for veterans?
Yeah, thank you for the question, Ranking Chair. The 10-day inventory that we created back in March of 21 did help. Quite frankly, there were many. There's inventories all over the place in VA, and by setting that goal, it really did help many of our VA medical centers and the beneficiary travel staff that exist on the front lines to focus in on that. As we also referenced earlier, we put together a claims processing team that would support those areas that may have been down one or two processors as they're trying to recruit additional, as well as any areas that required additional training. We can kind of help fill in that gap. Those things were not visible previously in a paper environment. We did not know those things. So BTS is helping us to manage the overall program.
And Mr. Ritzer, as VA takes steps to pilot more integrated technology with BTS-3, like the smartphone check-in system or the consolidated mail payment tool, what role can VSOs play in easing veterans into changes with existing systems?
I think the role that we can play for VA is to give them the veterans experience from a user standpoint. We could tell them what works, what doesn't work. What are the barriers that we have to be able to get to or not to be able to get to the VA benefits that we're trying to obtain? I mean, I can even provide them my own experience of what it was like to try to use BTS-3 with regards to this system. Even though I'm a metropolitan person, but I have fiber optics, I was able to share with them that with the 1 gig system, I still got timed out. 15 minutes later, I was timed out. But as an advocate, we can also provide the veterans experience from our veterans who are coming to us. Our national service officers, this is something that has been challenging us for years. And I was out in the field I'm with DAV for 21 years, and 14 of those 21 years was advocating for our veterans. So back in 2003, when I started, this was a problem. I actually went to the cashier window. I had the kiosk. When those two were in place, we were good. We were getting our benefits. But when we went with technology and we did not have the other resources, that's where VSOs can help them, is to tell them, pause, stop, take a moment, let's keep what's working running, and as we move forward, let's figure this out. And one of the challenges that they have with like community care, interoperability. This is the same challenge, and this is something that we're waiting for VA to get their electronic health record system modernized, so we have that interoperability to be able to do the scheduling components. Then we can get the reimbursement verification. Or we can help them to think about, from the Veterans Healthcare Administration, how we do business with Veterans Benefits Administration, dealing with the old concepts of fully developed claims, direct claims access or submissions. We have SCP, Stakeholders Enterprise Portal. So they should leverage using us because we have the experience and we have been testers for them behind the VA firewall also.
Thank you. I yield back.
Representative Self, would you like to have another round?
Absolutely, Chairman, thank you. I'll be honest with you. I came into this hearing thinking that you had made great progress because of your percentages. I am less convinced now. Once again, and I make this statement often, the VA comes to us and tells us about all the inputs, the new systems, the new hires, the new organizational structure, the new something. And in this case, it's another new shiny IT system, but it looks to me like you've failed to take into account age of the veterans, access to an automated system, the rural aspects of this, and frankly, what I see is not a complete buy-in to the community care system as a whole. And I understand you don't have full visibility on that. But Mr. Hyman, you said something like you've got more knowledge. That's an input. What about the veterans? What about the veterans getting proper payments on time? This system, once again, is in the infancy. After all this time and all this money, I don't see how it's going to be cheaper and better, because supposedly when you do something, it should be cheaper and better. I just don't see how you're going to do that with the system in its infancy until you take into account these 4 issues that I've laid out for you here. I don't think you've taken them into account. So once again, I just encourage the VA to think about the veterans. How are you going to make things better for the veterans rather than just rolling out a new shiny system? With that, Mr. Chairman, I yield back.
Thank you, Representative Self. Ms. Lee, is BTS capable of auto-adjudicating a travel claim for a community care appointment?
Not at this time.
Why is that?
I will pass that to Mr. Williams.
The system was in development for several years before it was implemented. And as you know, community care is a core part of the VA healthcare. So why is this not taken care of? Especially, again, for the rural states like Wyoming, Representative Hageman was just here, Montana, where a lot of the times the veterans have to utilize community care.
So the reason we can't auto-adjudicate a mileage, say a simple mileage claim to a community care appointment is we don't have a way to verify the appointment occurred from a data perspective. We do have an integrated project team with the Office of Integrated Veteran Care, which runs our community care program, to obtain that data. We expect to be able to test that data point in advance of the medical claim coming. So we expect to be able to test that this fall and be able to begin auto-adjudicating community care claims within BTS.
So we're 4 years into the program. Community care has been around the whole time, and we're just now getting around to hopefully this fall introducing the system so that the people that utilize community care can get their reimbursements. Ms. Lee, as you prepare to put BTS 3 on va.gov, how is the veterans' experience going to change, and what risk are you preparing for?
So as we add va.gov capability to the system, there's a couple things that change. First off, is they'll be able to view their claims with all their other claims, so they can see the status of their claims just alongside with all their other claims. They're also able to look at their appointments and be able to submit claims based on those appointments in the system instead of just at the time of service.
So how is it going to work easier? Okay, if we have a system that independently isn't functioning properly yet, and now we're going to link it to va.gov, which isn't functioning properly yet. Like two bads are going to make a good. I am sorry, but I don't understand how this is going to help the situation. So what are you going to resolve by putting that on va.gov? And how are you not going to exasperate the problems that they're already having?
So one of the things that will change in va.gov is they will only have one login. As he mentioned earlier, right now, if you log into va.gov, then you have to log into another system when you access BTSSS. So that will solve some of the issues. In addition, we're going to have, or we do have, end-to-end claims process visibility, so we can see as claims are submitted, we can see throughout the entire process until it's adjudicated that it made it through the process.
So with my limited, again, knowledge about how this all works, are you going to be able to auto-populate, once you place this information in va.gov, is it going to start auto-populating all the way down through the different areas so that the veteran won't have to continue to create this new information?
So it will take the information submitted by the veteran through our Claims Ingest API and get it to the BTSSS backend system to be adjudicated.
Okay, I still have a little bit of time here. I'm still very concerned about that the VA has struggled to implement this relatively small IT project. Your counterparts in EHRM program keep telling me how they're going to turn this effort around, and I'm very skeptical. EHRM is 1,000 times bigger than BTS3, and it certainly has racked up the bill to go along with it. What did the VA get wrong during the development and initial implementation of this project? I think I'm going to ask you, Mr. Retzer, that question because I believe I'll get a more unbiased answer.
I think what they got wrong was they didn't start with us, the veterans. They should have been with us from the beginning of this. They should have been hearing us about our challenges right when they did shut off the kiosks, that we didn't have alternative methods. They should have reached out to the Veteran Service Organization because we do have the experience of what their challenges are behind the VA firewall and outside the VA firewall. So they should have contacted us for ideas and even with their algorithm to determine, are we creating too much restrictions? So we would have been able to help them navigate this.
Thank you. Thank you very much, Mr. Retzer. Representative Sherfless McCormick, you still have a question, correct?
Yes.
Go ahead.
Mr. Hyman, one of the challenges we've heard today is that the VA has not been the best manager, the messenger, or trainer of the implementation for the tools. What is the VA doing to improve their communications with staff, patients, and VSOs?
Yeah, thank you for the question, Ranking Member. We are developing a multi-prong communications and outreach that we expect to launch in the coming months. So that's number one. Number two, I think as these system enhancements find themselves, we do believe that the uptake of interest in actually using the system will increase as well. So those two things I think I would offer to answer.
Mr. Hyman, I'm glad to hear that many of the upcoming technology improvements that the VA is implementing to make BTS3 more accessible. However, I'm concerned that the VA is attempting to add new features without addressing foundational issues in the first version of the self-service tool, like login errors and network latency. How will the VA's migration to va.gov as the portal impact veterans and veterans' experience with BTS3?
Yeah, thank you for the question. And we are taking have very close eyes on any sorts of integrations. One of the key ones I had mentioned is My Healthy Vet, that we've gotten feedback that is appreciated and is helpful. Many veterans use that tool already to renew prescriptions and check on appointments and all of these types of things. So that type of mentality exists with the future of VA.gov that Ms. Lee was describing. To where they really truly do have a one-stop shop where they can interact with both their health and their benefits interactions.
Thank you. I yield back.
Thank you, Ranking Member, and I now recognize Representative Self.
Ms. Lee, you said that they would have better visibility of all of their claims. It's been demonstrated to me by my veterans that there is a list of documents, PDFs, under their claim when you go in to their account, yet the PDFs are not live links. And when you copy the link, it won't take you there, because when you copy the link, you're outside the system. So I question whether or not they're going to have any more visibility in their total claim universe with this system, because it's been demonstrated to me that the PDFs are not live links. They do not have today total visibility of their claims that they currently have. And I yield back.
Thank you, Representative Self, and I now recognize Ranking Member Sherfless McCormick for her closing statements.
Thank you, Mr. Chairman. I appreciate the testimony and answers from our witnesses this afternoon. While VA's travel reimbursement program has connected many veterans to their rightfully earned health care, it's clear that BTS 3 has faced challenges since its inception. Improvements and refinements to the auto adjudication process, improvement payments, and improper payments and veteran utilization are critical to both the success of this modernization effort and to providing exceptional care for veterans. We've highlighted today's BTS 3 is an important tool, especially for our rural veterans, who represent almost a quarter of all veterans in the United States. Accessing medical services in rural America poses significant challenges for veterans who may have to drive hours and seek lodging in order to attend their VA appointments. I'm glad to see that the VA seems to be taking steps in the right direction. However, it's time for the VA to hold its operational offices to the goals they have set. Our veterans, caregivers, and survivors deserve as much. Thank you, Mr. Chairman. I yield back.
Thank you, Ranking Member Sherfless McCormick. 4 years after its launch, the BTS 3 system is still missing its mark. The plan was not well thought out, and I'm concerned that its managers at the VA still do not have a clear picture of the future in their vision. Another commercial off-the-shelf IT system has collided with the complexity of the VA. No one thought about basic requirements like how to confirm that veterans attended their community care appointments. Once again, we're left to spend millions of dollars re-engineering a system that doesn't work. If the VA can't execute a relatively small project like this, why should anyone on this dais feel confident when VA executives come up here to pitch their next multi-billion-dollar scheme? I want to assure the veterans that we will be closely monitoring this system and insisting that the VA extensively test any new software before rolling it out. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include any extraneous material. Without objection, so ordered, and this hearing is adjourned.